All right, it looks like the CDC team has been doing a great job of answering questions in the chat. So if there is nothing else, maybe we can move on to our next speaker, who is also from the CDC, and we'll be talking about something a little different, and that is a little bit more experimental, and that's diagnostic assays for monkeypox virus, how they're used and what they are.
And can you hear me okay?
Yes, hear you and
Okay,
see your slides. Perfect.
great. Let me know if you have any problems. My Wi-Fi has been struggling a little bit. So good afternoon, everyone. I'm Christy Hutson. I am chief from the monkeypox virus and rabies branch within CDC, and up until yesterday, I was the lead of the laboratory and testing task force for the monkeypox response. So as Anna mentioned, this presentation will be a little bit different, so hopefully it's still interesting and useful to everyone. I am going to give just a brief introduction to infectious viruses. Most of you are probably very familiar with them at this point. Some of CDC's past preparedness activities and how we had some tools to use in this monkeypox outbreak at the start of the outbreak, and then a little bit on our diagnostic testing and some research activities, some of which have not started, but we are preparing to begin. So when we look at chordopox viridae, there are other pox viruses that cause human skin lesions. Molluscpox, some of you are probably familiar with. If you have kids, this can be spread human to parapox viruses are usually spread from cows, sheep, and goats. You have Yatapox, which also can cause some skin lesions, and of course, orthopox viruses, which generally cause the most severe human disease. And it's really interesting when you look at orthopox viruses across the globe. They are greater than 90% genetically similar. And this is how we were able to eradicate smallpox, the use of vaccinia virus, which is closely related and in the orthopox virus group. And it's really interesting that we've had these for centuries, but new isolates actually continue to be identified, such as Alaska pox virus and then Akameta virus, which is a country of Georgia. When we look at the different orthopox virus species, not all of these actually cause human disease. Amelia vector 1 is one you might be familiar with. It only causes disease in mice. And then when we look at the ones that cause the most severe human disease, of course, variola caused smallpox, and then monkeypox is what is currently causing this outbreak and is considered the most serious human health threat since the eradication of variola. So to go through our preparedness activities, we really have focused on smallpox preparedness. And so since 1999,
documentação e qualquer outra coisa que a gente falar além da documentação.
sorry, there's an open mic, maybe.
Sorry, I'm trying to mute that.
Okay. So in 1999, the Institute of Medicine really asked that the U.S. smallpox research agenda focus on diagnostic assays, clinical guidance, and training of healthcare professionals. In 2009, this was updated, and we really started to focus on regulatory risks, as well as validation of medical countermeasures. This schematic just shows our current smallpox preparedness efforts. We do have to get WHO approval every year to this year. It's validated by the WHO, and it has to have a direct human health impact. You can see that we have focused on vaccine-based assays, next generation vaccine development, antiviral therapeutics for smallpox, and then we actually have a small animal model, a humanized mouse model for smallpox. And so all of these are very closely related and synergistic, and you might be wondering why I'm showing this in a monkeypox symposium, but we often have to use surrogate orthopox viruses before we do any actual work like viruses. So much of the work that supports the smallpox research agenda has been done with monkeypox virus and other orthopox viruses. For diagnostic testing, Many are probably familiar with the United States. It's an integrated network of laboratories. It's in predominantly our state and local public health labs. You can see this map that shows the location across the country. It's also in military, and then we actually have some international LRN labs. And these labs respond to a bioterrorism or other public health emergency. So CDC has worked many years with these LRN labs, 3% FDA tests within the labs. And so this includes our non-variole orthopox test, which is what test is predominantly being used for the current monkeypox outbreak. And then we also have FDA cleared variola specific tests within these labs. I wanted to show you this because this is a schematic testing algorithm public health labs use. So this was specifically made for variola virus so that our state EPIs can determine if a patient is low or high risk for smallpox. The main reason I wanted to highlight this is because we actually work with the LRN labs on an almost annual basis, scenarios where we actually send them clinical cases or mock cases describing a patient, such as someone who had travel history, has a history of fever, etc. That mock scenario goes along with specimens that are spiked with specific viral DNA. So it's a way for us to work with the state EPIs and the state levels that they're very familiar with this algorithm and also run and how to interpret those results. So even though we're not testing variola vaccines on a regular basis, thankfully, these PTs that we the labs really help to keep them ready to respond to an orthopox virus outbreak. And that was how they were ready on the outbreak within the United States. I wanted to touch on antivirals because this is also work that's been pushed through the smallpox research agenda. We currently have 2 compounds that are FDA approved for treatment of smallpox. Many of you are probably familiar with TPOX, which targets a viral protein that's needed to form, that should say EV, apologies, the extracellular virion. And so it stops the virus exiting the cell, but you still need the patient to produce an immune response to actually clear that infected cell. And then we also have Tembexa, which halts the viral DNA polymerase to halt viral replication. Both of these were approved on animal data since there's no smallpox cases. So we're just learning about how effective TPOX in particular is for treating monkeypox. And then when we look at our smallpox vaccines, vaccinia virus, as I mentioned, was used in the smallpox days to eradicate. And it's actually a live virus that is contraindicated for many individuals, especially those with certain skin complications, such as progressive vaccinia, with eczema, and so it can result in progressive vaccinia. So one of our goals has been to develop a safer vaccine. Bavarian Nordic's Imvamune is one that we've tested in our lab to look at the neutralization against variola virus from vaccinated individuals. And this is the vaccine that is now being used to prevent and to vaccinate those at risk for monkeypox. And so everyone is very familiar with the current monkeypox outbreak. This is just the current global numbers, which can be found on our CDC webpage for anyone who is interested. So for testing, we started out in our LRN labs, again, which already had the FDA cleared test because of the smallpox research agenda. And so at the start of the outbreak, those labs had the capacity to test around 10,000 per week. This is a non-variola orthopox test, so it doesn't specifically test for monkeypox. So the labs were sending us all of their orthopox positives for additional characterization testing. CDC has clade 1, clade 2, and generic monkeypox tests. Since the numbers of specimens went up so rapidly, some of the labs are actually only sending us a percentage of their orthopox positives now. And because we don't have any other circulating orthopox viruses that cause systemic disease, and the couple of odd ones we know about that cause localized infections, such as Alaska pox and the North American pox viruses, which aren't very well studied, those do not cross-react with this non-variable orthopox test. So when you have a positive with that test, it is probable for monkeypox. Although our capacity was quite good, it was soon apparent that we really needed to increase access. So we worked with some commercial labs to move our CDC non-variola tests to those labs. And so now we have a capacity of about 80,000 tests per week. These are also up on our CDC webpage. If you're interested, it just shows the percent positivity and how many tests are run per week. And you can see that we are seeing a downward trend, which is great. Hopefully that continues. And the orange bar just shows, again, that 80,000 capacity and where we are in demand related to total capacity. So switching gears a bit, just to touch on some of our research efforts. And I have the little asterisks there because this, of course, is not everything, but I just wanted to mention some of our research that we're focusing on. We are one of the WHO collaborating centers for smallpox and other poxvirus infections. So we did want to assist as much as we could our international partners as a WHO collaborating center. So this is just a few of the things that we did. Early on, it was apparent that positive control material for PCR tests was a real problem for a lot of countries, and they couldn't actually receive monkeypox DNA even to use as a positive control. So NIST is a organization we worked with. They developed a synthetic DNA PCR standard. Since it's synthetic, it's easy to ship, it's BSL-1. And they actually made this so that it would work with many different PCR tests, so both orthopox generic and monkeypox. And my understanding, at least at the start of the outbreak, I believe this is still true, is that it's actually free for individuals to get. They just have to pay for shipping. And this shows the different targets that it works with. And we actually tested this within our lab with our 5 different PCR tests, and it worked quite well. And then we also have worked to test some commercially available PCR tests that WHO was interested in sharing with countries that need those tests. So that is an ongoing project. We also have been interested in point of care tests, and Gene Expert is one many of you are probably familiar with. Again, we set out with developing a Gene Expert platform, or not the platform, but the reagents for our smallpox preparedness work. So for those who aren't familiar with Gene Expert, it's very small in size, so easy to set up in small areas and takes very little technical training to run. It's a closed cartridge, as you can see the little schematic down there, and actually the extraction and PCR occurs within that cartridge. So minimum processing is needed, which is great for safety. Dr. Lee et al. Did develop these targets within our monkeypox Gene Expert, and so that is actually already published. And they took this into DRC and validated it with skin lesion material from monkeypox infected individuals, and it worked very well. It was compared to the real-time PCR tests. And so this actually has both orthopox generic as well as a monkeypox specific target, which is nice for us because, again, for smallpox, we want to be able to differentiate a smallpox case from a monkeypox case, and this would help us to do so. And so there was an actual news release where Cepheid and BioGX are working to make this commercially available. So this is the same test that we designed. They've changed it a little bit, so they are sending us cartridges to work with in our lab just to make sure the test still performs well. Some other research efforts we are undertaking is we're really interested to see if there's a specimen that can be used for detection of monkeypox before rash onset. So we know lesions are the best specimen to use when they are present, but is there something that we can test before lesions to determine if someone is infected with monkeypox? We have an ongoing study with our DC public health partners to look at blood, throat swabs, and rectal swabs from individuals that are at high risk of monkeypox. So we just started receiving those specimens in our lab in the last couple of weeks. And then we are also doing some serologic and PCR testing, looking at retrospective studies, trying to determine if monkeypox was circulating prior to the first confirmed case in the United States. We're also looking at targeted populations to see if there are undetected monkeypox circulating using both serologic prospective studies and also PCR testing of bank specimens from, for instance, STI clinics where maybe they weren't tested for monkeypox, but they might be suspects. Anna, I see you on there, so I'm almost done. Transmission during the outbreak is something we're also looking at, as well as animal studies to compare pathogenesis. Very quickly, wastewater detection is really interesting, and this wastewater scan is a public site. It shows wastewater within California from Emory, and I believe Stanford. And so CDC is also starting to look at wastewater as well across the country in the coming weeks. Sequencing you heard all about, and then we also do TPOX sensitivity testing within our lab. If there is any concern about TPOX resistance occurring in a patient, then we'll actually culture the virus and confirm sensitivity. And with that, lots of people to thank, and thank you, Anna, for the invitation, and happy to take any questions.
Thank you so much, Christina. That was a really nice summary of the different considerations that need to go into testing. If anyone would like to ask a question, feel free to unmute yourself while I scan the chat for questions. And we do have one last minute, 5-minute talk if you guys would like to hang around.